Hi, my name is Jennifer Held. I'm going to be your nurse practitioner student today, and I'm going to do a circulatory and skin assessment on you, if that's okay. Is that okay today?
Yes.
Okay, I'm going to wash my hands. I'm going to simulate it to help save some time. All right, first thing I'm going to do, the nurse has already checked your vitals and everything. Everything seems fine. I'm going to check your hair. Okay, I'm going to look at her head. Her hair is evenly distributed. This hair is very thick. Look at the back of her head, and I will look at this side. And we already know from before, no problems. And then I would use my Q-tip, which would be my soft tip one here, and I'm going to look at her hair. No problems there. And looks good. No nits. Any problems with your head at all, Annie? No? Okay. All right. Now the next part is going to be, I'm going to look down, I'm going to look at her head. I do see a little scar here, as we discussed earlier, from the tree. Skin is normal for ethnicity. Okay. Looking at her skin, I'm going to look at her sclera. It is nice and white, no problems. Skin or cheeks are a little red, that's to be expected. Everything else seems to be fine. I'm going to look at your lips real close here. Good circulation of upper and lower. We got a couple little, just pimples, little papules right there. Nothing too bad. So I'm going to look with my light inside your mouth. Okay, yep, no problems there. Good color, good circulation. Okay, and close your mouth for me. Okay, so now I'm going to just look over your arm, so you can sit back a little. Okay, and actually your chest, I'm just going to look. I'm not going to expose your young lady. I'm not going to expose her breast or anything. That's another part of the exam. I got a little bruise here, but it doesn't look like it's complicated. It looks like it's healing well. Checking both arms. You put both your arms in front of you there. Oops, we've done that. I'm going to check your pulses. Thank you. Okay. And then I'm going to check your radial pulses. And then I'm going to check there. And then I'm going to check your epicenter here. You can see that right here, about 3 centimeters. And no problem on this side, and I can find it. On that side, her hair is equally distributed. We do see a couple little moles here, or little spots. And we will just go over those. I will be looking for cancer markers. We'll do the A, B, C, D. I did have a paper that I had, the book had said to show, give her the paper. We're going to talk about asymmetry, borders, color, diameter, and evolving. So we would work with this together, and I'd send her home with that so she can monitor that with her parents. Otherwise, we're fine. Let's see, I'm going to check out her neck, behind her ears for circulation. And looks pretty good. And looks good. Looks like the ears got a little circulation. Oh, and that's yours from, that's normal, right? Your cauliflower ear? Okay. Looks good. And then we're going to check your hands. No rudder. Looks like no cyanosis. So I'm going to flip her fingers over. I'm going to check if she wasn't wearing nail polish. If we were in the clinic base, I would have her take her nails off, or nail polish off at least one finger. But there's no signs of cyanosis. Good capillary refill. And then I'm just going to on the one hand, and then we'll know what's going to happen on the other hand too, just to save time. All right, hold on. All right, I'm going to cut off the circulation by the venous flow by pushing on the radial arteries. Okay, go ahead and open them up, and look how pale that hand looks. And then there goes your color back. Okay, we'll do it again, and there goes your color back. All right, there we go. All right, let's see. Hands equally distributed. The hair is really normal for ethnicity. Comparing the skin on her. Thank you. Normal temperatures. I'm feeling. I will switch my ring around to feel though the back of her skin. And then we will go there. Everything seems fine. Trying to think of the next step. Actually, I'm going to keep moving down your body, and I'm going to have you lay straight back. I'm going to use a pair of gloves. Get it down a pair of gloves. I'm going to check for her inguinal nodes, and then her femoral pulse. I'll be going from the bottom up instead of through the top. That way it doesn't expose the young lady to more than necessary. Okay? And so I'm going to lift her shirt up, and I'm going to just right here on the top, I'm going to feel for that hip joint. Oh, your hips are up there. Okay, and I can feel little nodes. There they are. There's your lymph nodes. They kind of feel like little bumps. They're not inflamed. They're not swollen. They're not irritated. Any pain there? Any tenderness? Nope. Right in there. Okay. And then I'm going to kind of come in front of her. We're going to feel for her femoral pulses. So I'm going to feel. Yep. And now with her, I have her pick her leg up just slightly. Thank you. Good. Nice, strong. Then I'll feel this leg. Okay. Nice and strong. Okay. So I'm going to feel down your leg there. And then while I got my gloves on still, I'm just going to feel for your popliteals. And right behind your kneecaps, nice strong pulses. The pulses are about we would describe it as like a +2. Oh, sorry. About a +2, which would be is the normal. It's not bounding and it's not diminished. They're nice and strong. So I'm going to continue down her legs. I'm actually going to take my gloves off. So it's easier to feel on the hands. I'm going to feel her posterior tibulus here. And then on the top part of her foot, I'm going to feel right there for her dorsal pedis. And that's the same place on both feet. Okay, I'm going to feel the temperature again. Look for hair distribution. She does shave her legs, but it does appear to be, the hair does appear to be symmetrical on both sides. No distribution notice. I do see a little bruise here with a scratch. Appears to be secondary to, you have a dog?
Yes.
Okay. What I'm going to look for here is any signs of infection or anything, and this seems to be very superficial. No other problems. I think we're good. So then the next thing is going to be the last one, and kind of the funner of the funnest here. So we're going to lift your legs up, and actually I will lift her legs. Excuse the dirty feet, but she's a kid. So we're going to go to about a 60 degrees. So this would be 90. So we're going to go to about 60 degrees. What we're going to do is we're going to hold it up here for a minute and let the legs kind of lose some of the circulation there. So you're feeling the feet are a little chilly, a little cool to temp, and at this time we can also re-examine the toes. Like I said, be looking for circulatory changes. She does have her nails painted, but I'd be looking for cap refills. Good, no problems there. And then, are you ready? So what we're going to have you do now is I'm going to have her, not too fast, she's not dizzy or anything, and in the next 15 seconds here, I'm starting to see some pinkness. Her legs are starting to pink up a little. Circulation is returning to the legs. And while I got her here, I'm also going to check her back, because I had her laying on it. No problems with her skin on her back. Oh, don't let your show up too much there. Okay, I'm going to check the back of her legs. I'm looking for any varicose veins or anything, and I do not see any porosities. Looks good. Okay, I'm going to have you sit up here one more time though. One thing I did forget to check, edema. Swelling. So I'm going to have Annie sit back for me. What I'm going to do is I'm going to put my thumb, for about 5 to 15 seconds there. About 5 seconds, I'm going to put my thumb in her top of her foot and on the side of her ankles. And then I'll make my way up her shins. And I am seeing a slight edema on her left side. And we are aware of that. That's been chronic for her. And I think that's it. Do you have any other questions, Annie?
No, thank you.
Okay, we are all set then.
Thanks.